fertility preservation techniques and procedures, oocyte retrieval and cryopreservation, introduction to oocyte retrieval and cryopreservation. Oocyte retrieval and cryopreservation are essential fertility preservation techniques allowing individuals to store eggs for future use. This procedure is commonly performed for both medical and non-medical reasons, including cancer treatments, gender-affirming therapies, and elective fertility preservation. Key topics covered: what is oocyte retrieval and cryopreservation, indications for oocyte cryopreservation, step-by-step process of oocyte retrieval, cryopreservation techniques, slow freezing versus vitrification, success rates, risks, and ethical considerations. 1. What is oocyte retrieval and cryopreservation? Definition: oocyte cryopreservation, egg freezing, is the process of extracting, freezing, and storing a woman's eggs for future fertility use. Why is this important? Preserves reproductive potential before medical treatments that could impair fertility. Allows individuals to delay childbearing for personal, social, or career reasons. Provides options for fertility preservation in transgender individuals before hormone therapy. Oocyte retrieval and freezing are essential steps for fertility preservation and assisted reproductive technologies, ART. 2. Indications for oocyte cryopreservation. 1. Medical indications: cancer patients undergoing chemotherapy, radiation, which can cause ovarian damage. Autoimmune diseases requiring gonadotoxic treatments, e.g. lupus, rheumatoid arthritis. Endometriosis and ovarian surgery, which may reduce ovarian reserve. Bone marrow transplant recipients at risk of premature ovarian failure. 2. Non-medical elective indications: delayed childbearing due to career or personal reasons, preserving fertility before gender-affirming hormone therapy, transgender individuals, family history of early menopause or diminished ovarian reserve. Fertility preservation should ideally be performed before ovarian reserve declines significantly before age 35. Third step-by-step process of oocyte retrieval and cryopreservation. 1. Pre-treatment evaluation. Before the procedure, a comprehensive fertility assessment is performed, including checkmark hormonal tests, AMH, FSH, estradiol to assess ovarian reserve, baseline transvaginal ultrasound to evaluate antral follicle count, infectious disease screening, HIV, hepatitis, etc. 2. Ovarian stimulation, controlled ovarian hyperstimulation, COH. Goal: stimulate the ovaries to produce multiple mature eggs and a single cycle. How it works: daily gonadotropin injections, FSH, LH, for 10 to 14 days. Frequent ultrasound monitoring to track follicle growth. Final trigger injection, HCG or GnRH agonist, to mature the eggs. Monitoring is critical to adjust medication dosages and prevent ovarian hyperstimulation syndrome, OHSS. 3. Oocyte retrieval procedure, performed under mild anesthesia or sedation. Transvaginal ultrasound-guided aspiration is used to collect eggs. A thin needle is inserted into the ovarian follicles to aspirate the fluid and retrieve mature eggs. The procedure takes 15 to 30 minutes with minimal recovery time. 4 oocyte cryopreservation freezing techniques. Once retrieved, the eggs are evaluated and frozen using one of the following techniques. 1. Slow freezing, older method. Gradual freezing process to avoid ice crystal formation. Lower success rates due to potential egg damage. 2. Vitrification, preferred modern method. Ultra-rapid freezing process using cryoprotectants prevents ice crystal formation, preserving egg structure. Higher survival rates, approximately 90% upon thawing. Vitrification is now the standard technique for oocyte cryopreservation. 4. Success rates and future use of frozen oocytes. Survival rates. Approximately 90% survival rate with vitrification. Approximately 75 to 80% fertilization success after thawing. Future use. When ready to conceive, eggs are thawed, fertilized using ICSI, intracytoplasmic sperm injection, and transferred via IVF, in vitro fertilization. Younger eggs frozen before 35 have higher success rates in RT treatments. 5. Risks and ethical considerations. 1. Risk of oocyte retrieval and cryopreservation. Ovarian hyperstimulation syndrome, OHSS. Rare but can cause abdominal pain and swelling. Procedural-related risks. Mild bleeding or infection after retrieval. Uncertain future success. Not all frozen eggs result in live births. 2. Ethical considerations. Informed consent. Patients must understand that freezing does not guarantee pregnancy. Fate of unused eggs. Options include use, donation, or disposal. Access and affordability. Should elective egg freezing be covered by insurance? Ethical and financial concerns continue to shape fertility preservation policies worldwide. Summary. Key takeaways. What is oocyte cryopreservation? The process of retrieving, freezing, and storing eggs for future fertility use. Who needs it? Medical. Cancer patients, autoimmune diseases, early menopause risk. Non-medical, career planning, lack of a suitable partner, transgender individuals. Key steps in the process: ovarian stimulation with hormone injections, egg retrieval via transvaginal ultrasound aspiration, freezing via vitrification for long-term storage. Success rates and risks: higher survival rates, approximately 90% with vitrification. Risks include OHSS, procedure-related complications, and uncertain future pregnancy outcomes. Ethical considerations: informed decision-making and affordability are key concerns. Final thought: oocyte retrieval and cryopreservation provide fertility options for those facing medical or personal challenges, but success depends on age, ovarian reserve, and technological advancements.